CEN Written Exams Reddit. Question 1. A patient with sepsis has a MAP of 55 mmHg despite fluid resuscitation. The CEN should anticipate which vasopressor? Option A, dopamine. Option B, norepinephrine. Option C, phenylephrine. Option D, epinephrine. The correct answer is option B, norepinephrine. Norepinephrine is the first-line vasopressor for septic shock. It increases MAP through vasoconstriction and is preferred over dopamine due to a better safety profile. The sepsis protocol recommends early broad-spectrum antibiotics, within 1 hour, 30 ml/kg crystalloid, and vasopressors for fluid refractory shock. MAP target is 65 mmHg. Question 2. A patient with a known abdominal aortic aneurysm, AAA, presents with acute, severe back and abdominal pain. The CEN should: Option A, obtain a CT with contrast. Option B, prepare for emergency surgery. Option C, administer 4 fluids for hypotension. Option D, all of the above. The correct answer is option D, all of the above. This patient has a ruptured AAA until proven otherwise. The priority is surgical consultation and preparation for emergency repair. CT may be done to confirm but should not delay surgery. 4 fluids should be given cautiously, permissive hypotension, to avoid increasing bleeding. This is a time-critical surgical emergency. Question 3. A patient with heart failure presents with severe dyspnea, pink frothy sputum, and rales auscultated halfway up the lung fields. The CEN should anticipate which intervention? Option A, 4 normal saline bolus. Option B, 4 furosemide and nitroglycerin. Option C, 4 epinephrine. Option D, immediate intubation. The correct answer is option B, 4 furosemide and nitroglycerin. This patient is in acute decompensated heart failure with pulmonary edema. Management includes diuresis, furosemide, and afterload reduction, nitroglycerin, to reduce preload and afterload. Oxygen and non-invasive positive pressure ventilation, BiPAP/CPAP, may also be used. Normal saline would worsen volume overload. Intubation may be needed if the patient fails non-invasive measures. Question 4. A patient with a dislocated shoulder should be assessed for which complication? Option A, vascular injury. Option B, nerve injury, axillary nerve. Option C, fracture. Option D, all of the above. The correct answer is option D, all of the above. A dislocated shoulder requires a neurovascular assessment before reduction to identify any injury to the axillary nerve or axillary artery. Fractures, Hill-Sachs lesion, Bankart fracture, may also be present. Documenting the neurovascular status is essential before and after reduction. The patient should have an X-ray before and after reduction. Question 5. A patient with capacity refuses life-saving treatment and wants to leave against medical advice, AMA. The CEN should: Option A, allow the patient to leave after documentation and ensuring the patient understands the risks. Option B, restrain the patient and start treatment. Option C, call the family to persuade the patient. Option D, call security. The correct answer is option A, allow the patient to leave after documentation and ensuring the patient understands the risks. Patients with decision-making capacity have the right to refuse treatment and leave AMA. The CEN should document that the patient was informed of the risks of leaving, and the benefits of treatment, and that they understand. The patient should sign an AMA form. Restraint and treatment without consent are only permissible if the patient is a danger to self or others, e.g., suicidal, psychotic. Question 6. A patient with a crush injury to the lower extremity presents with pain, swelling, and dark urine, tea-colored. Which complication is the CEN most concerned about? Option A, compartment syndrome. Option B, rhabdomyolysis. Option C. Fat embolism. Option D. Infection. The correct answer is option B. Rhabdomyolysis. Crush injuries can lead to rhabdomyolysis, characterized by muscle breakdown and release of myoglobin, leading to dark, tea-colored urine, elevated creatinine kinase, and risk of acute kidney injury. Treatment includes aggressive hydration, normal saline, alkalinization of urine with sodium bicarbonate, and possible dialysis. Compartment syndrome can also occur, but dark urine is a classic sign of rhabdomyolysis. Question 7. A patient with acute stroke has aphasia. The CEN should: Option A. Speak loudly and slowly. Option B. Use simple, short sentences and allow time for response. Option C. Avoid speaking to prevent frustration. Option D. Write everything down. The correct answer is option B. Use simple, short sentences and allow time for response. Aphasia, language impairment, often expressive or receptive, in stroke patients requires patience and clear, simple communication. Speaking slowly and using short sentences reduces cognitive load. Speaking loudly is not helpful as aphasia is not a hearing problem. Avoidance limits communication. Writing may help some patients but should be combined with verbal cues. Speech therapy consultation is appropriate. Question 8. A patient with a migraine presents with a unilateral throbbing headache, nausea, photophobia, and phonophobia. What is the first-line treatment? Option A. Triptan, sumatriptan. Option B. Acetaminophen. Option C. Morphine. Option D. Metoclopramide. The correct answer is option A. Triptan, sumatriptan. Triptans, 5-HT1B/1D receptor agonists, are first-line agents for acute migraine, especially when the patient presents early. They are effective at aborting the headache. Acetaminophen and NSAIDs are for mild headaches. Metoclopramide is an antiemetic that may be given as an adjunct for nausea. Morphine is not recommended for migraine due to poor efficacy and risk of medication overuse headache. Question 9. Which finding in a patient with asthma exacerbation indicates life-threatening status asthmaticus? Option A. Wheezing. Option B. Silent chest. Option C. Peak expiratory flow rate, PEFR, 70% predicted. Option D. Cough. The correct answer is option B. Silent chest. A silent chest on auscultation in a patient with severe asthma indicates minimal air movement and impending respiratory failure. This is a life-threatening sign requiring immediate intubation and mechanical ventilation. Other indicators include confusion, exhaustion, PEFR 33% of predicted, and SpO2 90%. Question 10. A patient with subarachnoid hemorrhage presents with a sudden thunderclap headache, nuchal rigidity, and photophobia. Which diagnostic test is the initial gold standard? Option A. Non-contrast CT head. Option B. Lumbar puncture. Option C. MRI brain. Option D. CT angiography. The correct answer is option A. Non-contrast CT head. Non-contrast CT head is the initial test for suspected subarachnoid hemorrhage, SAH. It has a sensitivity of 90 to 95% within 24 hours of onset. If the CT is negative but clinical suspicion remains high, a lumbar puncture is needed to detect xanthochromia, indicating breakdown of red blood cells in the CSF. CTA may be done to identify the source of bleeding, but CT is the initial diagnostic test. Question 11. A patient with asthma exacerbation is on continuous albuterol and ipratropium nebulizers, systemic steroids, and magnesium sulfate. Despite treatment, the patient's SpO2 drops to 85%, and the patient is becoming lethargic. The CEN should anticipate: Option A. BiPAP. Option B. Intubation and mechanical ventilation. Option C. Heliox therapy. Option D. Chest tube insertion. The correct answer is option B. Intubation and mechanical ventilation. This patient is in impending respiratory failure due to severe asthma, lethargy, hypoxia despite maximal therapy. Intubation is required. BiPAP may be tried but is often ineffective in severe asthma with obstruction. Heliox is a rescue therapy but not first line. Chest tube is not indicated. Question 12. A patient with capacity has a living will that states do not intubate. The patient is in respiratory failure. The CEN should: Option A. Intubate the patient. Option B. Not intubate the patient. Option C. Call the family to ask for permission. Option D. Ask the patient's primary nurse. The correct answer is option B. Not intubate the patient. A living will, or advance directive, is a legal document that states the patient's wishes regarding life-sustaining treatment. The patient has capacity and a valid living will stating do not intubate, so the CEN should not intubate the patient. The healthcare team should respect the patient's autonomy and end-of-life wishes. The family cannot override the patient's wishes unless the patient is incapacitated. Question 13. A patient presents with a sudden onset of sharp, pleuritic chest pain and shortness of breath, but no trauma. Lung sounds are decreased on the left side. What diagnosis should the CEN suspect? Option A. Spontaneous pneumothorax. Option B. Pulmonary embolism. Option C. Pericarditis. Option D. Pleurisy. The correct answer is option A. Spontaneous pneumothorax. Spontaneous pneumothorax occurs without trauma, often in young, tall males or patients with underlying lung disease, COPD, asthma. It presents with sudden, sharp pleuritic chest pain and dyspnea, with decreased or absent breath sounds on the affected side. Management includes observation, supplemental oxygen, or chest tube placement depending on size and symptoms. Question 14. A patient with COPD and a history of hypercapnia is being treated with oxygen. The CEN should aim for a target SpO2 of: Option A 100%, Option B 94 to 98%, Option C 88 to 92%, Option D 85 to 88%. The correct answer is option C, 88 to 92%. For patients with COPD and chronic hypercapnia, CO2 retention, the target SpO2 is 88 to 92%. This balances adequate oxygenation with avoiding oxygen-induced hypercapnia, depressing the hypoxic drive. The target for healthy patients is 94 to 98%. High oxygen concentrations should be avoided in these patients. Question 15. A patient with a nasal fracture presents with epistaxis. The CEN should: Option A. Have the patient pinch the nose and lean forward. Option B. Have the patient lean back to prevent bleeding. Option C. Insert a nasal packing. Option D. Apply a cold compress. The correct answer is option A. Have the patient pinch the nose and lean forward. The first step for anterior epistaxis, nosebleed, is to have the patient pinch the nose, applying direct pressure, and lean forward to prevent blood from flowing down the throat and causing aspiration or nausea. If this fails, nasal packing, anterior or posterior, may be needed. Cold compress may be used as an adjunct. Posterior epistaxis is a more serious presentation that may require ENT consultation. Question 16. A patient presents with anxiety, palpitations, and a feeling of impending doom. Vital signs: HR 110, BP 140/90, RR 22. The patient reports a stressful event. The CEN should: Option A. Rule out medical causes, ACS, PE, hyperthyroidism, etc. Option B. Administer a benzodiazepine. Option C. Reassure the patient and send home. Option D. Perform a psychiatric evaluation. The correct answer is option A. Rule out medical causes, ACS, PE, hyperthyroidism, etc. Many psychiatric symptoms, panic attacks, anxiety, hyperventilation, can mimic medical emergencies. The CEN must rule out medical causes like ACS, PE, hyperthyroidism, and thyrotoxicosis before treating the patient for anxiety or panic disorder. An ECG, labs, thyroid, glucose, and appropriate imaging should be considered. Once medical causes are ruled out, anxiolytics may be considered. Question 17. A patient who is 8 weeks pregnant presents with vaginal bleeding and unilateral pelvic pain. Which diagnosis should the CEN suspect? Option A, miscarriage. Option B, ectopic pregnancy. Option C, placenta previa. Option D, normal pregnancy. The correct answer is option B. Ectopic pregnancy. Ectopic pregnancy should be suspected in any woman of childbearing age with abdominal/pelvic pain and vaginal bleeding, especially with risk factors, history of PID, tubal surgery, or IUD use. Unilateral pelvic pain, hypotension, and shock can occur with a ruptured ectopic pregnancy. Quantitative HCG and transvaginal ultrasound are diagnostic. Ruptured ectopic pregnancy is a surgical emergency. Question 18. A patient with suspected tuberculosis should be placed on which type of precautions? Option A, contact precautions. Option B, droplet precautions. Option C, airborne precautions. Option D, standard precautions. The correct answer is option C. Airborne precautions. Tuberculosis is transmitted via airborne particles, droplet nuclei. Patients with suspected TB should be placed in an airborne infection isolation room, AIIR, with negative pressure. Staff should wear an N95 respirator or a powered air purifying respirator, PAPR. Contact and droplet precautions are for other types of infections. The patient should wear a mask during transport. Question 19. A patient with a psychiatric emergency is placed on a legal hold, e.g., 5150. The CEN should: Option A, allow the patient to leave if they are calm. Option B, inform the patient they are on a legal hold and document. Option C, call the police to discharge the patient. Option D, ignore the legal hold. The correct answer is option B. Inform the patient they are on a legal hold and document. Patients on a legal hold, involuntary psychiatric hold, are not allowed to leave until they are evaluated. The CEN should inform the patient of the hold and document the process. The patient must be kept safe and in a monitored environment. The hold is a legal order, and leaving would be against the law. The CEN should not discharge the patient. Question 20. What is the primary mechanism of injury in a patient with a flail chest? Option A, penetrating trauma to the chest. Option B, blunt trauma with fractures of 3 or more adjacent ribs in at least 2 places. Option C, sudden deceleration injury. Option D, compression injury causing rupture of the diaphragm. The correct answer is option B. Blunt trauma with fractures of 3 or more adjacent ribs in at least 2 places. Flail chest occurs when 3 or more adjacent ribs are fractured in 2 or more places, creating a freely mobile segment. This paradoxical movement impairs ventilation and may lead to respiratory failure. The underlying pulmonary contusion is often the main cause of hypoxia. Treatment includes pain control, oxygen, and possible mechanical ventilation. Question 21. A patient presents with testicular pain, dysuria, and a fever. The testicle is tender. Which diagnosis is most likely? Option A, testicular torsion. Option B, epididymitis. Option C, orchitis. Option D, hydrocele. The correct answer is option B. Epididymitis. Epididymitis is inflammation of the epididymis, often due to infection, UTI, ST. It presents with gradual onset of testicular pain, swelling, tenderness, fever, and sometimes dysuria. It is differentiated from torsion by gradual onset, versus sudden, and presence of fever. Doppler ultrasound shows increased blood flow in epididymitis, versus decreased in torsion. Treatment includes antibiotics and NSAIDs. Question 22. A patient with a head injury has a GCS of 8. The CEN should: Option A. Intubate the patient. Option B. Elevate the head of the bed to 30 degrees. Option C. Administer mannitol. Option D. All of the above. The correct answer is option D. All of the above. A GCS 8 indicates severe head injury and a need for airway protection and management of elevated ICP. Intubation is indicated to protect the airway and manage ventilation. Head elevation to 30 degrees reduces ICP. Mannitol or hypertonic saline is used to reduce ICP. All interventions are indicated in severe head injury. Question 23. A patient in the ED is agitated and at risk of harming themselves. The CEN should use which type of restraint? Option A. Physical restraint only. Option B. Chemical restraint. Option C. Physical or chemical restraint, as indicated. Option D. Seclusion. The correct answer is option C. Physical or chemical restraint, as indicated. Restraints, physical or chemical, are used to protect the patient or others from harm. They should be used as a last resort when de-escalation has failed. Physical restraints include soft limb restraints, chemical restraints include medications, haloperidol, benzodiazepines. The CEN should monitor the patient closely and reassess for the need for restraint. Question 24. A patient presents with severe eye pain, headache, nausea, vomiting, and a cloudy cornea. Which diagnosis is most likely? Option A. Central retinal artery occlusion. Option B. Acute angle closure glaucoma. Option C. Retinal detachment. Option D. Corneal abrasion. The correct answer is option B. Acute angle closure glaucoma. Acute angle closure glaucoma presents with severe eye pain, headache, nausea, vomiting, a red eye, a cloudy cornea, and a fixed, mid-dilated pupil. It is an emergency requiring immediate reduction of IOP with topical beta blockers, alpha agonists, carbonic anhydrase inhibitors, and hyperosmotic agents. Miotic agents, pilocarpine, are used after the acute attack is controlled. Question 25. Which of the following is a classic finding in a patient with pericarditis? Option A. ST segment elevation in all leads. Option B. PR segment depression. Option C. Chest pain that worsens with inspiration. Option D. All of the above. The correct answer is option D. All of the above. Pericarditis presents with diffuse ST segment elevation, often concave upward, PR segment depression, and chest pain that is pleuritic, worse with inspiration, and better leaning forward. It is often viral in origin. Treatment includes NSAIDs, colchicine, and steroids if refractory.